People say, I say cannabis is safe. I've never said cannabis is safe. All I've said is it's safer than alcohol. And therefore, if people want to make a rational choice to be intoxicated with cannabis rather than alcohol, that's a perfectly sensible thing. I'd recommend never being intoxicated with any drug. But if you want to use a drug to change your mind, cannabis is going to cause you less harm in the long term than alcohol.
Are we going?
Yeah.
You picking me up there?
Not so much, but so let's just check. Having something. Ooh, actually, I'm just gonna fiddle with this quickly.
The policy on cannabis has been wrong since it was brought in the 1970s. It's been wrong because cannabis is a medicine, has always been a medicine, and should be available to patients in this country as a medicine. And of course, the other aspect of the cannabis policy, which is criminalising young users, has created an underclass. About 1 million young people, many of them black or Asian, have been given criminal records for cannabis possession. And we know that the criminal record is going to do much more harm to their lives than the cannabis that they smoke. So on both counts, stopping medical research, stopping medicine, and inappropriately criminalising people, it's not just wrong, it's been a disaster.
So let's just check. Having something.
If you take the study, the Swedish conscript study, which is the only study with enough numbers of people in it to be able to say there is a risk of schizophrenia, statistically, we looked at that data. If you take it at face value, then you've got to stop 5,000 young men or 7,000 young women from ever smoking cannabis to prevent one case of schizophrenia. So you can see it's a pretty rare event as a result of smoking cannabis. What we've learned in the last 20 years is that some people do become dependent on cannabis. I think we knew that, but now we can say that is a fact. Beyond that, actually, we've learned very little else. The truth of the matter is, if you go to school at 15 stoned every day, you're not going to perform very well, and you're not going to enjoy school. And so it's the same as if you went to school drunk every day. And in fact, the studies which say that cannabis produces long-term negative outcomes are confounded by the fact that many of these people drink, smoke, and also come from disadvantaged backgrounds. Now, a group in Bristol called the Alspat Group have looked at asked the same question of 10,000 British school children, and they've shown that cannabis is no more likely to lead to school dropout and poor performance than alcohol or tobacco. The politicians need to be honest about what they know. Most politicians know that cannabis is less harmful than alcohol. Most of them know that the law actually is doing more harm than good, but they just haven't got the courage to say it. The two main parties are sort of in a Mexican standoff. They're looking to see which one's going to move first. And if one moves, then the others will attack them to try to get political advantage before the next election. We spend £2 billion a year criminalising people for using cannabis. £2 billion. That should be put into treatments or research. A complete waste of money. Everyone knows about the ABC classification. A being the most harmful, C being less harmful. Everyone also knows that drugs are in the wrong classes there, but put that to one side. There's another form of regulation called the schedules. And drugs which are put into Schedule 1, like cannabis, like MDMA, like psilocybin, this schedule is treated as they are the most harmful drugs. Whereas drugs that are put in Schedule 2 or 3, hospitals can hold. So any hospital can hold heroin or morphine or even cocaine, because those are seen as medicines, and therefore hospitals and pharmacies can hold them. But Schedule 1 drugs are not seen as medicines, so you need a special license to hold those. Within the cannabis plants, there are about 80 different chemicals, many of which are likely to have medicinal value. What we know from the work that has been done, and a lot of this was done before cannabis was banned, We know that cannabis has a particular pain-relieving properties. It has properties to reduce spasticity and muscle spasm. It has quite an interesting profile in terms of cancer. A range of cancers seem to respond to cannabis. There's an enormous potential range of opportunities. In fact, I saw a paper last week showing that cannabis can reduce the production of the amyloid protein, which can cause Alzheimer's.
Really?
In mice. So it might even be anti-dementia. But most of those studies have not been properly developed in humans because there's virtually no one in Britain with a license to do cannabis research in humans. I say 4 hospitals in the whole country. There's 600 hospitals, only 4 of them can hold the drug.